Imagine this, it's a quiet evening. You're home alone, maybe reading a book or watching TV. Suddenly, your chest tightens. A strange pressure builds, and you feel short of breath. Pain creeps into your left arm, and your heartbeat becomes irregular. You're sweating, dizzy. You realize this isn't just fatigue or indigestion. It's a heart attack. But you're alone. No one is there to call for help, no one to drive you to the hospital, and you have only moments to act. This terrifying scenario is more common than we think, especially for seniors over 70. Every year, thousands face this exact moment. My uncle, 74 years old, was one of them. He collapsed in his living room late at night with no one around. But he survived. Not because of luck, but because he remembered 5 life-saving actions to take immediately. Those first 60 seconds saved his life. He prepared ahead of time, and that preparation gave him a fighting chance. If you or someone you care about is over 70, you must know what to do in those critical moments. This video isn't just important. It could be the most important thing you watch today. Because in a crisis, knowledge is survival. Number 11, recognize the early signs. Even the silent ones. One of the most dangerous aspects of heart attacks in seniors is that the symptoms are often not what people expect. We're used to imagining heart attacks as dramatic, sudden events with severe chest pain, clutching the chest, and collapsing to the floor. While that can happen, the reality for many, especially those over 70, is very different. Heart attacks can be silent, subtle, and easily mistaken for something else. That's why recognizing the early warning signs is not just important, it's essential to survival. As we age, our bodies respond differently to medical emergencies. Seniors often experience what are known as atypical heart attack symptoms. These include persistent fatigue, nausea, dizziness, cold sweats, shortness of breath, indigestion, and even back, jaw, or neck pain. Some may feel unusually tired days before the heart attack actually strikes. Others may have trouble sleeping, or just feel an overwhelming sense that something isn't right. These symptoms might not seem dramatic, but they are your body's way of sounding the alarm. For example, many older adults report feeling lightheaded or unusually weak in the days or hours leading up to a heart attack. You might feel like you've just run a mile, even though you've only climbed a short flight of stairs. You might experience what feels like indigestion that won't go away, even though you haven't eaten anything unusual. You may even feel anxiety or a sense of doom with no clear explanation. These are not random feelings. They could be your body's quiet cries for help. Women and men over 70 often experience different warning signs. Women in particular are more likely to experience jaw pain, nausea, and fatigue instead of sharp chest pain. Because these symptoms don't always fit the textbook definition of a heart attack, they often get ignored until it's too late. And here's what makes it worse: many seniors dismiss these signs. They tell themselves it's just old age or maybe a bad meal. They wait it out, thinking it will pass. But waiting is what gives a heart attack the power to do more damage. The longer the heart muscle goes without oxygen, the more tissue dies, and the lower the chances of recovery. That's why every minute counts. The good news is that once you're aware of these subtle symptoms, you can train yourself to act quickly. If something feels off, especially if it's unusual for you, don't brush it off. Listen to your body. If you suddenly feel unwell, short of breath, or intensely fatigued without a clear reason, take it seriously. It's better to call for help and be wrong than to ignore the signs and risk your life. Being prepared starts with awareness. Knowing the early signs gives you the power to respond fast. And for seniors, that awareness could be the difference between life and death. Number 2, call emergency services. Immediately when it comes to heart attacks, hesitation can be deadly. The second you feel something is wrong, when those symptoms start, whether it's chest discomfort, shortness of breath, or overwhelming fatigue, you must take immediate action. The most important and life-saving step you can take is to call emergency services right away. Do not wait to see if it passes. Do not convince yourself that it's just indigestion, a pulled muscle, or a panic attack. If there's even a small chance that it could be a heart attack, pick up the phone and dial 911 or your local emergency number. One of the most common mistakes seniors make during a heart attack is underestimating the severity of their symptoms. Many people, especially those who live alone or don't want to, cause a fuss, try to tough it out. They lie down, drink some water, or hope the discomfort will fade. Others might even drive themselves to the hospital. These choices can be fatal. When you're experiencing a heart attack, every minute that passes without medical help increases the damage to your heart muscle. The longer you wait, the worse the outcome can be. Calling emergency services isn't just about getting to the hospital faster. Paramedics are trained to begin life-saving treatment as soon as they arrive. They can provide oxygen, administer medications like nitroglycerin or aspirin, monitor your vital signs, and most importantly, keep your heart stable on the way to the hospital. This means that calling 911 doesn't just save time, it buys you more chances to survive. Every second counts during a heart attack. The faster you get professional care, the more heart muscle can be saved, reducing long-term damage and increasing your chances of a full recovery. Another important reason to avoid driving yourself is the risk of losing consciousness behind the wheel. Heart attacks can cause sudden arrhythmias, fainting, or extreme weakness. Getting behind the wheel in that state puts you and others on the road in danger. Even if the hospital is close by, it's far safer to let professionals come to you and start treatment immediately. It's also important to understand that not all heart attacks come with overwhelming pain or collapse. You might be alert and able to speak when symptoms start, but that can change in minutes. That's why acting quickly is so important. Make sure your phone is easy to access and consider keeping emergency numbers on speed dial. If you use a medical alert system, know how to activate it. You should also talk to your family or neighbors about what to do in case of an emergency. But above all, empower yourself. Don't hesitate. Don't second guess. The moment you suspect a heart attack, call emergency services immediately. It's not overreacting. It's taking control. That single decision could be the one that saves your life. Number 30, take aspirin. If safe for you when a heart attack strikes, every second matters. One of the simplest yet most effective things you can do to increase your chances of survival after calling emergency services is to take an aspirin, but only if it's safe for you. This isn't just a home remedy or a myth. Aspirin has a medically proven role in reducing damage during a heart attack. It works by thinning the blood and slowing down the formation of clots that are blocking the arteries supplying blood to your heart. During a heart attack, a blood clot typically forms in one of the coronary arteries, stopping the flow of oxygen, rich blood to a part of the heart muscle. When you chew a regular strength aspirin, usually 325 mg, it gets into your bloodstream quickly and helps to inhibit the platelets that cause clotting. This action can help keep the blockage from getting worse and may even reduce the size of the clot. It doesn't stop the heart attack, but it can give you more time until emergency medical help arrives, and that time could mean the difference between life and death. The keyword here is chew. Swallowing aspirin whole will slow down how fast it works. Chewing allows the medicine to be absorbed more rapidly through the lining of the mouth and the stomach. You should never delay taking aspirin in favor of water or food. If your doctor has previously told you that it's safe for you to take aspirin and you suspect a heart attack, chew it immediately after calling emergency services. However, it's crucial to understand that aspirin is not safe for everyone. Some people have allergies to aspirin or medical conditions like gastrointestinal bleeding, ulcers, or clotting disorders that make aspirin dangerous. That's why you should always talk to your doctor beforehand and ask you, if I ever suspect I'm having a heart attack, should I take a number 4 seat? Unlock your door. Help needs in. In a medical emergency like a heart attack, the actions you take in the first few minutes can mean the difference between life and death. After you've recognized the symptoms, called emergency services, and, if approved by your doctor, take an aspirin, there's one more step that many people overlook, but it can be just as critical. Unlock your door. It might seem like a small detail, but if emergency medical technicians, EMTs, can't get inside your home quickly, valuable time is lost. Every second that passes while responders try to figure out how to get to you is a second your heart is struggling without enough oxygen. When the brain and heart are deprived of oxygen, damage begins in just minutes. That's why ensuring fast and easy access to your home is an act of preparation that could save your life. If you're conscious after calling for help, your next move should be to unlock the main door to your house. Whether it's a front door, apartment entry, or gate, whatever stands between you and the emergency team, remove the obstacle. If possible, leave the door slightly ajar so they can enter without delay. If you have a security system, disable it so that alarms don't add chaos to the situation or slow responders down. Many heart attacks happen when seniors are in bed or upstairs. If you feel yourself becoming weak or disoriented, but are still able to move, try to get as close to the main entrance as possible. Even if walking isn't an option, crawling or sliding toward the front door could dramatically increase your chances of being found quickly and treated without delay. EMTs are trained to help, but if they can't get to you easily, they may have to break down the door or wait for fire department backup. That's precious time you may not have. If you live alone, consider keeping a key hidden in a lockbox outside your door and giving the code to a trusted neighbor or family member. Some seniors even register this information with local emergency services so that responders can access it if a call comes from their home. Alternatively, you might install a smart lock that can be opened remotely or with a simple code. These small steps in advance make a big difference when seconds count. It's also smart to keep your house number clearly visible from the street, especially at night. Emergency responders may arrive quickly, but still lose valuable minutes trying to confirm your location. Clear numbers, working porch lights, and an open path to the door are all part of preparing your environment to work in your favor when time is tight. In a crisis, you don't want rescuers wasting time figuring out how to get in. Make unlocking your door a priority, because help is on the way, and they need to reach you as fast as possible. It's a simple action, but it could save your life. Number 50, practice the co-CPR. Myth with caution. In the world of medical myths, one that has circulated widely is the idea of co-CPR. This myth suggests that forceful coughing can keep your heart beating if it stops or goes into arrhythmia during a heart attack. Some believe that by coughing deeply and forcefully at the right moment, you can stimulate the heart and keep it pumping blood to your vital organs until help arrives. But here's the truth. This is a dangerous oversimplification, and it is not a universal fix for heart attack victims. While the concept of coughing to maintain circulation has some scientific grounding, it applies only to very specific cases of arrhythmia, such as a certain type of heart rhythm disturbance called pulseless electrical activity. This occurs when the heart is still electrically active, but isn't actually pumping blood effectively. In such a case, coughing may temporarily create a pressure effect that can help push blood through the body for a short while. However, these cases are extremely rare. The majority of heart attacks involve blocked coronary arteries, which cannot be treated with coughing, and the heart needs much more than a cough to recover. The danger of relying on the co-CPR myth is that it can give you a false sense of control in a life-threatening situation. The focus should always be on getting medical help immediately, not on trying unproven and unverified methods to buy time. When you suspect you or someone else is having a heart attack, you should prioritize calling 911. Emergency responders can begin administering life-saving interventions, including CPR and defibrillation, much more effectively than any coughing method ever could. CPR, when performed properly, can double or even triple a person's chance of survival after a heart attack or cardiac arrest. The American Heart Association and other health experts stress that if someone is unresponsive and not breathing, you should perform chest compressions without delay and continue until help arrives or an automated external defibrillator, AED, can be used. This is the scientifically proven life-saving technique. It's simple, straightforward, and far more effective than any alternative methods like coughing. The real issue with co-CPR is that it distracts people from more critical actions. If you're focused on coughing forcefully, you're not thinking about what you should be doing: calling emergency services, taking aspirin if safe, and if necessary, performing traditional CPR. In those precious first minutes after a heart attack, your best bet is to act swiftly and follow proven life-saving protocols. It's also important to note that even in cases where the co-CPR might theoretically work, it requires the person to be conscious and aware, which isn't always the case in a heart attack. Many heart attacks cause loss of consciousness, and in these cases, the coughing method becomes irrelevant. So, if you ever find yourself in a situation where someone is having a heart attack, remember this: the myth of co-CPR can be harmful, and it's not a reliable substitute for proper medical attention. Always call 911 and follow verified medical advice. Your swift and correct response will be the key to saving a life.